Hi everyone, welcome back to Cosmo Care Clinic. So, few days ago, a patient came to us. She happens to be our regular patient, and her whole family come to us. So, this happened when uh, she came back. She came to us with emergency checkup as she fell down at home. It was very worried and in pain also, like what happened and why it is so painful and everything. So we do, we did the general checkup as well as some X-rays, and we get to know she has two front teeth which have been fractured, and one was like significant tooth loss. One has significant tooth loss. So the ideal treatment for that tooth was just RCT and cap only. But when we like through X-rays and with thorough checkup of the both the tooth, we get to know that it looked like one is just chipped off, but it had fine lines of fracture, which later on, like in 15-20 days or in a year, will break off as per her usage or as per the force distribution while chewing or while speaking or while just even a slow hit from a baby also, the tooth can fracture soon. But the thing is, again, ideally both teeth had to go for RCT and capping only. But the thing was, when her child was very small, very young, uh, that baby got into same accident and she fell and she had to undergo a dental treatment procedure. At that time, she had to go just for like fillings, and now she's like 20 years or something, and the film is going on. That's a really great thing. Wow, thing, an amazing thing as dentist. Whoever did it was really a good job. But the thing was, she was trying to convince us, as her daughter also got the films only, and those films were so good that it's going on still. Please go for the filling procedure or the composite build-up procedure only for her too. Now the thing is, we can't go for the same treatment or the same procedure in both the cases. Possibly, what her daughter went through was just a chip off. But here we can see a proper fracture, and there is a fine line of fracture on that chip of tooth also. We can't risk it. But she was not ready for that as she was going through multiple dental treatments. So she convinced us, or she kind of maybe forced us to do the fillings or the build up only. But this is not the right thing to do or right thing to ask from a dentist. We are very happy to help you out, and you have to trust us. We are not here to mint all the money or money laundering. We are not here for that. We are actually here to help you out. We can see or we know that we actually sure about it that sooner or later she will be coming back to us and will be asking and will be going for the same procedure which we told, that is RCT, root canal treatment with tapping. But because she was very humble at that time, she was very emotional, we just did the build up and we sent her. But we explained her thoroughly that okay, this is not the right treatment for these two teeth. And you all have to understand this thing. You have to realize that okay, Google can say you many things, even videos can show you many things, and all the patients, all your relatives have gone through multiple treatments for same incident. But please try to understand that what your doctor, what your dentist is saying to you is most important thing, because they can see what you can't and they can analyze what you can't. So trust your dentist, please. And there are so many videos going on, like do the herbal treatment, holistic treatment and all. जब वो ट्रीटमेंट हमारे यहाँ अवेलेबल होगा, जब वो टेक्निक हमारे यहाँ अवेलेबल होगी, हम वो सब करेंगे. जब तक वो नहीं है तो तब तक अपने डेंटिस्ट पे ट्रस्ट तो करो. वो आपके भले के लिए यहाँ पे क्लिनिक पे बैठे हैं, आपकी हेल्प करने के लिए. आप चाहोगे या आप उनको बोलोगे कि कुछ परेशानियां हैं, कि फाइनेंशियल इश्यूज हैं, तो वो बहुत इजीली आपके लिए डिस्काउंट भी करेंगे. आई एम नॉट सेइंग एवरीवन डज, बट यस देयर आर पीपल हु डू. एंड आप बात करके तो देखो, सारे सॉल्यूशंस मिलेंगे, एंड जस्ट डोंट स्टिक टू वन ऑफ योर सॉल्यूशन ओनली। जो रिस्क फैक्टर्स होते हैं, हो सकता है उससे सिर्फ आपका खर्चा बढ़े। प्लीज अपनी डेंटिस्ट पे ट्रस्ट। तब तक के लिए बाय, नमस्ते।